Good morning and welcome back. About 12 minutes before 7 o'clock. Well, they cause problems for millions of people each year, yours truly included. But there are ways to treat and manage seasonal allergies. And joining us this morning from Gunderson Health System is Dr. Todd Mahr. Dr. Mahr, thanks for joining us this morning.
Thank you, Dustin. Pleasure to be here.
Well, it's great to have you, especially with a topic like this. Like I said, it affects me. I've been suffering from allergies for a couple of weeks now. My wife, it just sort of hit yesterday. Is this kind of a situation of us being affected by different things, or is it different reactions?
No, it's different things. In the fall, we have ragweed and weed, and then we have molds. And so they vary a little bit. And you may be more of a ragweed sufferer, which started a couple weeks ago. And as we have other weeds that start to pollinate, people have problems, and the mold counts go up. So you have to know, it's nice to know what you're allergic to. Not that you can really plan around it. You get a rainy day like today, and you can go, yay, my allergies are going to be better.
Yeah, certainly. It seems to vary day to day with reactions, and it seems like a lot of people have different severity levels with regard to reactions as well.
Yeah, some people have more of their eyes have symptoms, some people more of their nose, and it depends on their exposure. If you're the little guy who's going to go out and jump in that leaf pile that you talked about earlier, he may come out kind of miserable depending on what he's allergic to. And so those are some of the things we talk to people about who have allergies. Things not to do. Don't hang your bedding or clothing outdoors during your allergy season. Don't go jumping in leaf piles if you're allergic. Some simple things like that. Keep the windows closed during the night will help you so you don't get the exposure.
Now, you mentioned earlier getting checked out for to find out what types of allergies you may be affected by. How effective is that with regard to treatments compared to maybe just taking an over-the-counter allergy tablet?
Well, it's nice to know what you're allergic to. Now we have tablets that can dissolve onto your tongue for ragweed and also for grass. So knowing that you're ragweed allergic, we could have started you on this product about 12 weeks ago, and you may have had a better year this year. So finding out what you're allergic to, there's a lot of reasons. We also have allergy shots that can be used. And then we have, as you mentioned, the over-the-counter medications and prescription medications that can be used.
Do you think it might be a little bit cost with getting checked out that might be preventing people from going in and seeing what they're allergic to?
Yeah, for some people it's a barrier. For other people, they realize, I want to know whether it's a cold or it's allergies, and I can do things different. So if people are really suffering, it's lasting more than a couple weeks and it's happening all the time, I would advocate for you to get it checked out.
Of course. And then you have people like me who are stubborn and just deal with it every year as it comes, it seems.
Yeah, that's the male hormone sometimes does that.
All right, Dr. Mahr, thank you so much for joining us this morning.
Thank you.